Good morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement, in this morning for Dr. Steve Stites. We are here in the Dolph C. Simons Family Broadcast Studio. Today, we're going to hear about the vaccination rollout in Shawnee and Johnson County. Our guests are Johnson County Director of Health and Environment, Dr. Sanmi Areola, and Derik, Flur-log, the Infectious Disease Division Manager for Shawnee County Health Department. Derik is also a respiratory therapist. First, though, this morning, we'd like to take a second and check in with our Chief Medical Officer, Dr. Stites, who is at home. Good morning, Sunshine.
Hey, you know what, Sunshine? Yeah. That second dose of the Moderna vaccine does have more side effects than the first. I was doing pretty well, chugging along just great after the dose yesterday. And then around 5 or 6, I started getting a little chilled. By 8 o'clock, I had a temperature of 101. And I was wearing my down coat inside the house with a hat and gloves. And by this morning, it was still 102. So I thought probably the better part of valor is not to come into the hospital today with a fever, because I'd be violating the rules of infection control, which, of course, travel with you wherever you go. So you're getting me by phone. I think I've experienced most of the side effects, headache, nausea, fever, chills, muscle soreness. And so I'm here to tell you that the side effects are real, but they're very survivable. I'm still very glad I got the second dose of Moderna's vaccine. And I know it's going to lead to the right thing, so it's all tolerable. But it is a bit of a wallop sometimes. It does pack a punch.
Yeah, and I think, Dana, those are all things we would expect. Those are the common symptoms. I think we had them on a slide on the screen here. Those, I'll say, more mild, not that they are mild in the sense of unnoticeable, but they're not severe that mean you need to call your doctor or come to the hospital. Those more mild or common symptoms are what we're seeing frequently. I think you had maybe some of them yourself.
Yeah, really not the fevers, a little bit of chills, but it was really the malaise and fatigue, and it certainly did get better going into that next day, and by the afternoon it was quite a bit better. But he'll do well, and we want to say that we think it's a good thing because it means that your immune system is ramping up and working as it should. But in a contrast to that, even if you have mild symptoms or really no symptoms after that second dose of vaccine, that doesn't correlate with protection. You are still more than likely 98, 99% going to be able to get to the same immune response as somebody who has those symptoms. So that was a question that was come up yesterday as well.
And maybe one other thing to mention, there are a couple of side effects that we see with vaccines, including
compared to what people with COVID have.
Mm-hmm. Yeah.
Did Dr. Stites want to say something?
So they were mild compared to what people with COVID have. And I think to Dr. Stites' point,
compared to COVID.
Yep. And there's also, he's talking about, if you get to the disease, it's a lot worse. Right. That doesn't even include the side effects that we know with blood clotting, pulmonary embolus, all those other things that can occur long hauler with the actual COVID disease compared to the vaccine as well.
And so those symptoms
totally worth getting the vaccine.
Go ahead, Steve.
Mm-hmm.
I would say totally worth getting the vaccine. And then some really good news from the AstraZeneca front about prevention of transmission, at least some preliminary data. So not only may you not get the disease yourself, but at least the preliminary information is you may not transmit it. So that's exciting.
Yeah.
Hey, Dr. Stites, this is Jill. Can you clarify one question? When you were saying that you had your fever and so that would not, that we can't come in because that's part of our policy here at the hospital. Do you think you are contagious when you have this? We get that question a lot. Yeah.
I don't think I'm contagious, Jill, but I actually had texted Dana. He said, well, you can come in. I said, the only problem is I also have a splitting headache. I'm a little nauseous. So I don't think he really wants me right there by him this morning. And but I think it's all part of the vaccine, and I should be back very, very, and maybe even be back later this afternoon. I don't know. We'll see how rapid the recovery is.
Could you let everybody know, though, you already had plans to be off tomorrow, so let's put that out there right now.
I did. Yeah, I have a meeting at 8. I have to be in tomorrow, so I'll be there on Friday for sure. Dr. Wild will be there bringing the sunshine to you.
Got to do what you're good at, so you tell me.
Yeah, and I think going to that contagious question, again, this Moderna and Pfizer vaccines are only pieces the spike protein, the RNA of the spike protein that your body then will create the spike protein. So there's no viral particle in there, so you are not contagious for anything. Now, in this, we've also seen that people who have gotten the first and second dose, within that first 7 or 10 days, they can still get infected with the virus. But I don't think so in Dr. Steitz's case. I think this is all vaccine related.
Yeah. Well, I think it'll start with the vaccine.
One last point to make simply about the symptoms. There are a couple of things that you should call your doctor about if you do experience them that are maybe a little more concerning. So if you have trouble breathing or feel that your face or lips or tongue are swelling, have hives, or a rapid heartbeat that's not normal for you, or significant dizziness and weakness, those are things you should seek care for. Those are very rare, all of them, and most of them would be something that you would see in closer proximity, minutes to hours after your injection, but might happen at other points. So we don't want to miss any of those things. If you have those symptoms in any sort of relation, time-wise, to a vaccine, please do seek advice from your healthcare provider. So with that, I think we'll tell Dr. Steitz, thank you for calling in when you don't feel very well.
You bet.
I hope you're better here shortly.
Yep.
We'll
talk to you all soon. Thank you.
Thanks.
Get well.
All right. Well, before we get to the rest of the planned conversation this morning, Dana, how do we do overnight?
We're good. We're under that century mark, under 100 total cases in the hospital for acute and recovered. 41 acute, only 9 in the ICU, 6 of those are on the ventilator. 57 in that recovery period, with 6 still remaining on the ventilator. So that's 98 total patients. Hays has 19, but again, 7 of those are in the acute phase and 12 in that recovery phase. But I do want to temper that, and you know this better than anybody because you're our numbers guru here. Although our total number is down, our admissions are up, and our acute infections are even up a little bit from yesterday. And so if you want to elaborate on that.
Yeah, just a sort of a complex conversation to have. So the census numbers, the total count that are in the hospital today, is a factor of the number of new people, or new cases coming in, new admissions, and also then the number of people leaving, either because they discharge or because in some cases they don't survive. And the balance of that, right, is different for every patient. So the length of stay, some patients may stay in the hospital 2 days and some may be here 20. And so as we figure that out, census, the number of patients in the hospital, is really only one piece of that equation. And as we have watched the number of new hospitalizations per day, both here and across the state, they're stable. They're not really declining. And in some cases, we've had days where the total number of new hospitalizations in Kansas has been actually on the high side for the pandemic. So that's just a reminder that this is not gone, that there are still impacts to hospitals, and that it really is important to take the totality of the numbers into account when you try to paint the picture for what's happening right now. But definitely better, right? It's by all means better to have 98 than 198.
And I would say that we did have our ICU directors call, Louis Satterwhite, Dr. Simpson, and Dr. Castro here at the health system. And that includes other regional hospitals, but also local metro hospitals. And overall, what they were seeing is the total numbers of patients are going down as well. So that is a very good thing. We are moving into a weekend. It's going to be a very big weekend, hopefully a lot of celebrations. But let's do it in a smart, thoughtful manner and continue to not have those large groups or have those super spreading events, because we know it's not just that event, it's not that party, it's those second and third round of infections that really lead to increases.
Very true. All right, well, let's start with Derik this morning, as we've not heard from Shawnee County on the update before. Some of our viewers asked if we would invite you on, and we're glad you could make it this morning. Let's start with sort of an overview of your vaccine rollout plan in Shawnee County.
Yeah, thanks, Dr. Wild, and thanks to the University of Kansas Health System for having us on. We're glad to be here this morning. If I could have the control room pull up my slides, that'll help me out a bit. Be much appreciated. So here in Shawnee County, we're still working kind of on finalizing the details to our rollout plan, but what we're working on is something we're calling the Shawnee County Vaccine Collaborative. And this is kind of a partnership with our private providers here in the county, and they've been a huge help through this entire pandemic, really. This collaborative includes the health department, of course. We have Stormont Vale Health, and then St. Francis, which is a part of the University of Kansas Health System as well. And HaysMed Health, our federally qualified health center, is helping out as well too. And outside of this collaborative, we are working with the VA too, kind of with numbers, but they're obviously a federal entity. So much like the long-term care centers or nursing homes, they are being given vaccine from the federal government. So just some little details there that kind of matter in the grand scheme of things. If we could go ahead and go to the next slide. Thank you very much. Appreciate that. So phase one has been underway here in Shawnee County since about late December. And I know as of last night, we had administered over 3,200 doses just from the health department. And then our local departments, or local partners, excuse me, including the VA, have administered over 20,000 doses. And as we've kind of started to finalize our plan and put that into place, we've been gathering info in the meantime on those that are interested in getting the vaccine. That way we can have a good idea on our numbers, who we're going to be providing for, and kind of some of the gaps that we may encounter as we go through the phases. So the survey that we have, again, those that are affiliated with the healthcare system in Shawnee County can reach out to those health systems that we mentioned. And then our survey there on the slide is the phase one, phase two vaccine interest form. And I think our focus as the local health department, as always, is on that uninsured and unaffiliated population that fall within the phases of 2, and really what we're calling 2A at the moment for us here in Shawnee County, 65 and older, some of our K through 12 individuals in congregate settings. So, and of course, we're still working in the phase 1 healthcare and healthcare associated workers as well. I should mention too, my previous job was director at a long-term care facility. So keeping them in mind too, some that may have been missed or may not have been covered under the federal partnership, we're working them through as well. So quite a comprehensive look. I did want to paint the picture of Shawnee County here since we haven't been on before. And you can really see the exponential increase in our case numbers really as we went into late October and November. And to be quite honest, those numbers are staggering. They're still staggering. You can see the rate of increase there really just really opens your eyes. We did hit a high a couple weeks ago, just over 1,100 cases in 1 week. And I always bring up the point of when we were hitting over 200, 300 cases a week, we felt like we were drowning. And then to be doing, 1,000 plus, it's really almost impossible. It was impossible to contact all of those cases. We couldn't ensure isolation. We couldn't ensure quarantine individuals. And so we were really relying on our community to communicate with those they may have been in touch with. Next slide, please. So this is also our confirmed cases versus our deaths by week. And the deaths are going to be on the right-hand side. That's the 0 through 35. And new cases on the left, 0 through 1,200. And really what this is showing, if you follow the red line, is that as you see an increase in cases, it's almost always followed by an increase in deaths reported. And we saw that going into November. Those numbers have continued to come in. And we've seen that increase there in January too. So we're a little concerned about what we'll see here going into the next month. We did see a shift away from long-term care associated deaths more to community-based. And so that was concerning as well. Next slide. I just wanted to give a brief overview of kind of the structure that we are operating in. It's something called the ICS, the Incident Command. And we're led by Dusty Nichols, who's our incident commander. And then this really helps us communicate amongst city individuals and across departments. We have a wonderful liaison officer in Mayor Michelle de la Isla for the city of Topeka. And then on down the list there, some real great individuals that have helped us have a real comprehensive attack here in Shawnee County to try and get the cases under control. And, something I wanted to mention, our current allotment for vaccines here in Shawnee County is 1,950 doses per week. And we have about 60,000 individuals that we've identified that are in phase 2. And so doing the math, that's quite a drawn out process. We are hopeful that there will be an increased allotment eventually. And we would certainly welcome that and be excited for that. On our website, snco.us/HD, people can go to find our survey, our dashboard that contains our statistics. and really any info that you need concerning, questions about COVID, and can kind of go from there. So that's all I had prepared for you all. I appreciate the time and appreciate the opportunity to be on the program this morning.
Thanks so much, Derik. Many of the things that I would have asked, you hit on. The conversation about the supply of vaccines or the allocation to individual counties being really small compared to the demand continues. I think we'll hear that same thing from Dr. Areola. In fact, he and I have had that conversation more than once this week, so I know we will. But thanks for sort of painting the picture for what 2,000 doses per week looks like in the big picture based on the number of people in phase 2. The one thing that maybe you didn't hit on is you talked about the role of the health department in Shawnee County focusing on those that are unaffiliated or uninsured. Do you have an idea of how many people have indicated to the health department desire to be vaccinated through your clinics so far?
We are working on those numbers currently, and that's one of the important parts of the survey that I mentioned, is kind of gathering that data. We also have some of the congregate settings rescue mission, and our hospitals are also helping us kind of identify those numbers too. One of the concerns with vaccine rollout is equity, making sure we have equitable distribution of the vaccine. And so that's really important as the local health department. I think you all know that access to care and preventative medicine is really, really important. And so the vaccine allowing people that don't have insurance coverage to get the vaccine free of charge and to limit those barriers is really, really important in kind of stemming the spread of COVID-19 here in Shawnee County and across the country.
Yeah, very much agree. All right. Let's move for a minute to Johnson County and Dr. Sanmi Areola. Sanmi has become a friend throughout the last, 11 months, probably since we talked the first time. And I very much mean it when I say that these friendships and new relationships have been one of the silver linings of all of this. Having a great and tight relationship with our public health officials as a healthcare delivery system, I think, is imperative in our community. And so I thank you both, actually, for being here, and Sanmi especially for the chance that I've had to work with you. Welcome to the show this morning. I know we've had Dr. Lemaster on several times and appreciate his input. Let's maybe start with some of the questions we get regularly about Johnson County. So first of all, lots of questions from the community about how and where they can sign up or signal interest to receive a vaccination in Johnson County.
Thank you, David. Thanks for having me. I do want to echo what you said. It's very important for us to work together collaboratively as part of the same local public health system, and really appreciate the friendship and the opportunity. Now, in Johnson County, we have been very, very deliberate in our preparations and in how we prioritized within phase 2. It is a very large group. Estimate really have that group could be as many as 150,000 persons. And so we've got to attack that in multiple ways, and that's what we are doing. We are obviously running clinics. Last week, our clinics that were targeted towards 80 plus gave out about 7,000 doses of the vaccine. But we know that that's insufficient. That's why we've been working with KU Med Health System. That's why we've been working with the OLETA and the other health system to make sure that we are attacking this through multiple routes, through multiple avenues. Your question about how can people signify interest is a few weeks ago, we did create an online interest submission form. We're also asking really a few other questions that are critical to our planning efforts. And so as you're showing on the website, that's really where you go to get those information. It's jocogov.org, and you see the phase 2 COVID-19 vaccine interest form. We'll take some of your contact information. We'll ask questions about whether you are insured or whether you are affiliated with one of the health systems or not, and a few other questions that are very, very important to how we prioritize even within the large group. I'll talk about the 65 plus, for example. That's a very large group. There are over 95,000 Johnson County residents that are 65 years or older. And so even within that group, we have to do additional prioritization based on the data that we have. And as at a couple of days ago, we had over 150,000 records in that system. Of course, some of them are duplicates, some of them are not complete, but the interest has been very impressive.
And one of the other frequently asked questions is how is the county and the health department coordinating that prioritization with healthcare delivery systems? Is it the same? And is the county working as sort of the quarterback in coordinating that approach?
Yeah, excellent question. David, as you know, we have been meeting with all of our health systems for a few weeks now, and we've been talking through how this is going to work. And so we stay in touch, talk frequently. Again, the overarching goal is to create multiple channels through which our residents can obtain the vaccine. None is bigger than our health systems with proven and established relationships with our residents. They come to you for their medical care. They get their flu vaccine from you. Those are established relationships. And while there are subtle differences in the approach between the health systems, the overall goal remains the same, to get the vaccine into the arms of as many people as possible as quickly as we can. And I think for this stage, everyone is focused on the 65 plus within our health system. I know that's what your health system is doing. That's what Olathe Health is doing, Advent and others. Children Mercy is assisting us in focusing on the educators and childcare category, K through 12, and that's ongoing. Again, collectively, the goal is to provide multiple channels for our residents to be able to get the vaccine. And we're working on how to even increase the number of providers in the county, including other pharmacies that could provide the vaccines to people.
I'll say from our perspective, as a healthcare delivery system, the coordination has been excellent. As you mentioned, weekly meetings now for quite some time. To make sure that everyone is on the same page, that we understand how we're approaching the group that health systems are primarily tackling, the 65 and older that have an affiliation. One of the interesting questions there is what happens if you're not an affiliated patient of one of those health systems? And you might start by giving your perspective there.
Okay, so if you don't, and that's a question that I have received from a few people. If you are not affiliated with one of the health systems, then right now you can get vaccinated in one of our clinics. And I should say that at this point that if you have completed the online interest form, there's really nothing for you to do until you hear from us. We have your name, we have your information, and we'll reach out to you as vaccines become available. Now, availability of vaccine is the biggest factor here. We're not getting enough to spread around, even though we have the capacity across the local public health system, but we don't have enough vaccine. Now, we're looking at additional ways for you to be able to get the vaccine. Like I said, we are looking at working with local pharmacies to do that. But again, if we are only getting 6,800 doses of vaccines a week, and that's what we are distributing amongst ourselves between us and healthcare systems, that's not a whole lot. For a group or a phase that we're estimating could be as many as 150,000 persons, it will take a while. So if you are not affiliated with any of the healthcare system, for now, you come to one of our clinics. There will be additional opportunities, additional providers that we're working with. I should mention that we're also working with our federally qualified health center, health partnership clinic here, and they're going to be vaccinating also. And there are others, other providers, other avenues that we are working on. Again, the biggest factor, David, is we just don't have enough vaccines for now.
completely agree. We've been talking amongst our own internal group here that more avenues for vaccination is an excellent thing, but they only become effective when you have enough supply. And right now we are really in this conversation of you can only slice a pie so many ways. That no doubt is, I think, the biggest limiting factor across the board. I will touch for just a moment on sort of our approach to the if you're not currently affiliated with us as a patient question, because we get that from our patients or from those who maybe haven't sought care here before from across the metro area and really across the state. So we do have on our website the same sort of survey form that we've mentioned here from both counties, where you can indicate interest to receive your vaccine here, even if you're not a patient of ours. We take very, very, very seriously our responsibility to our community to improve the health of our community. And so we won't limit, we will not limit the ability to get a vaccine here to only our patients. That being said, we do schedule appointments to prevent walk-ins and long lines from impacting our ability to vaccinate rapidly the largest number possible per day. And so in order to schedule an appointment, we need information from you. That doesn't mean that there's a charge or anything like that. We don't have a new patient fee or anything of that nature. But the ideal for us is to allow you to self-schedule for a time, and that means you need to be registered in our medical record system and use a system called MyChart, your own sort of app to control your own scheduling. And so we get questions about that from time to time, those that signal their interest to receive their vaccine here, but that are not patients will get a link as their name is called, as their number is called, for example. And you'll need to go out there and do that or contact our call center to get scheduled. So we don't want that to be a barrier, but I did want to answer that question. We have an intent to vaccinate as long as we have doses, anyone really who needs it and is available. I think one other question, Sanmi, for you before we really move on to community questions. What if someone is 80 or older and in Johnson County and has not yet gotten the vaccine? Are they a priority? Is there some specific action they need to take?
So if you or your mom or dad is 80 or older, you remain priority within the 65 plus group in Johnson County. We're working some of them into our clinics this week, and we're working to have 2 clinics next week. Again, this still remains some of our most vulnerable residents, and we will not change the prioritization until we vaccinate everyone in that age group. So some are being worked in this week, and several more will be worked in next week. Again, what you need to do is ensure that you complete the online interest form, and you don't need to do that multiple times. We've had people complete that several times. Just one time is what we need, and when we open up vaccines and have appointments, we'll reach out to you and provide you information on how to book one of those slots. Again, similar to what David said, we have to manage the flow of the clinic, and so we are expecting certain number of people every hour, and if people don't stick to those times, it can be pretty disruptive. But if you've completed the online survey interest form, we'll reach out to you. If you are 80 plus, you remain the priority group that we are focused on now. And we're getting help from KU Med health system, other health systems in vaccinating other members of the 65 plus group. Again, it's not just the Department of Health and Environment alone, it's all of our partners working together. And the focus likely right now is on those that are in the 65 plus category.
Mm-hmm. Great. Let's see if there are any reporter questions on the line before we get to community questions this morning.
Hey, good morning. Cody Holyoke with Channel 9.
Cody.
Forgive us, the Zoom call just blinked out for a couple of minutes, so if I've asked a question you've answered, I apologize. I know with Dr. Areola, the challenges in Johnson County, supply is the major issue right now. What are some of the other issues that you're having to tackle behind the scenes that people might not know about?
Yeah, well, thank you. Obviously, this is a big operation. Having to vaccinate thousands of people every week requires a lot of coordination, and of course limited resources. Staff that really has been working on this for a year now, doing the testing, doing the investigations, and doing this. That's part of it. But Johnson County is a community. We're a family. We're having a county manager and other departments that are rallying around our staff and helping us man those clinics. It takes anywhere from 70 to 100 persons to run each of those clinics, but they've been very productive. On some days we vaccinated just under 1,800 persons in the 4 hours that we run the clinic. Other days it's been 1,500 or 1,400. Even though vaccine is limited, we are getting the vaccines out as we receive them. Virtually our goal remains the same, is we give everything that we receive that week out that week, and we've successfully done that. We are chipping away. We are vaccinating more people. We're getting the vaccines into the arms of our residents. This week, we are not just doing the 65 plus. We are giving second doses. We are vaccinating in our emergency services, law enforcement, police, fire, sheriff. And we are starting vaccinating in our K through 12 educator category through Children Mercy. Not as fast as people will want. Absolutely appreciative of the interest of our residents to get the vaccine, and they need to keep that up. Again, our goal is to give out the vaccine as quickly as we receive them. We're doing that. Continue to work with our health system, so we have multiple channels to do that. Again, that's a lot more efficient than depending strictly on the clinics that the health department can run.
Great. Yeah. Any other reporter questions on the line?
Hey, this is Alyssa with WIBW.
Hi, Alyssa.
My question is for Derik in Shawnee County. I know he mentioned wanting equitable distribution of the vaccine throughout our county. What are you doing for people maybe that don't have internet or something to access that survey online?
Hi, Alyssa. Thanks for the question. So beyond the survey, what people can do currently is call 251-4949, and we'll have someone that can help fill out that survey for them and take their information. Working on a couple of different potential ideas to help stem some of those inquiries, because that's, as the health department, again, that's one of our top priorities, whether you're in a pandemic or not, is to provide for those that are less fortunate, that don't have the access to care, access to internet. So we'll get their name on the survey, and I think moving forward, we'll have some other potential avenues to have some outreach to those groups as well. It'll take, again, I think, partnerships with some private providers and private entities, and we'll kind of go forward from there.
And have you had any issues with the phone lines being too backed up with people calling, or has that not been a problem yet?
Not a problem that I'm aware of yet. We have people in our call center, our information specialists, even supervisors who are taking calls at times, and we're all just gathering that info as we speak, getting it on the survey. We've had some email inquiries as well, and we've completed the survey for people that way too. So again, just kind of working through it. I think we'll have something as time goes on here in the near future. Hopefully that will help with those that may not have access to internet or a computer.
Thank you.
Thank you.
Great. Any more reporter questions?
Just one more from Cody for the health system specifically. I know that when you started vaccinating your own employees, you had these big, look like almost an auditorium set up for mass vaccination clinics. With that, with news of mass vaccination starting in Missouri, I noticed Kansas City was kind of left off that list, though rural suburbs were included. Is the Kansas University Health System working to do these mass vaccination events now as we get farther on in this pandemic?
So the short answer, Cody, is yes. I think there are some maybe distinctions to be made here. number one, and this is sort of present in the Missouri plan as well, there's maybe a distinction now between mass vaccination clinics, 9, 10, 15,000 people a day in a parking lot at Arrowhead, for example, versus high capacity or high throughput clinics, 1,000 or 2,000 a day in an existing healthcare facility. And so right now there aren't plans for truly those mass vaccination clinics here, primarily because of inventory, vaccine supply. But some things that we learned using the university space and our auditorium, for example, for our employees, is that works great when you're here on campus and you don't need to park and you don't need access for those with disabilities. But there really wasn't great public access to those spaces. And while they worked perfectly for administering large numbers of vaccines, for those that were healthy and easily mobile and could get around campus and were familiar with it, they weren't places that our patients could get to easily, were familiar with, and they weren't really designed to support any of those things that were needed for people with mobility issues or that needed other sort of help as they move from one appointment to another, for example, inside the health system. So we've actually been able to design our current clinic in our medical pavilion A to show or to be able to see and vaccinate the same numbers that we could in those larger auditorium spaces and truly be a high throughput clinic. So between the main campus and a clinic that we'll be able to run on our Indian Creek campus at 435 and Null, every week we can do 10,000 easily vaccinations and could probably even double that number if inventory supported it by using existing patient care spaces as these high throughput clinics. So when the time comes to be supportive of those true mass vaccination clinics outside in a parking lot, probably for phase 3 or 4 or 5 in the vaccination plan, we'll be able to support whatever is asked by the state or local governments and community organizations. But at the moment, we're really focusing on those high throughput clinics, and they'll just be in a different spot here because we recognized that our plan for our employees wasn't perfect for the needs of our patients.
Yeah, I think it's important to note that not an event, but just our day-to-day, how we go about business, if the supply's there, because we've done it, we've shown that we've been able to do it, and it's been safe for the patients, it's been safe for our providers. We just need that supply and that inventory.
All right. Any other reporter questions? If not, we'll jump right into community questions.
Anna writes, my question is, I have high blood pressure and anemia and asthma. Also, I am African American. Is it safe to take the vaccine? And my concern is, will there be an issue since I have a blood disorder?
The simple answer to that is yes, it's safe, and you should get it. If you are offered it, go ahead and schedule your time to get it. Yep.
None of those things should provide any concern.
Gail asks, is there a phone number for those without internet in Johnson County? I have elderly neighbors who do not use a computer.
Sanmi?
Yes, there is. And if you go back to the website and display that website, you would see the phone number there. It's 913-715-2819, just right where you are.
Great. Thanks, Sanmi.
A little bit up. It's 913-715-2819. And we have workers there that will pick up the phone and guide you through completion of the interest survey form or booking an appointment for you.
Dale asks, and he doesn't say which county, if 80-year-olds walk in without appointments, can you vaccinate them or do you register them and have them come back?
Yeah, so I think a great question for both counties. If someone walks in without an appointment to a clinic or to the health department, what is the process? And maybe we can start with Sanmi and then we'll hit up Derik.
Right. So we, it's not that we're encouraging people to show up without appointment, because the setup of the clinic is really well planned, and too many people showing up at the wrong time can be disruptive. but we have not been turning away 80-year-olds. If you show up, we'll give you your shots, but we really want you to wait until you have an appointment.
Yeah, I can echo those thoughts as well. At this time, it's appointment-based across the board. I do want to echo some comments that Dr. Areola mentioned. You know, if you've completed our survey, you've done your part, we will reach out to you, or one of the health systems will reach out to you. And at this time, our vaccinations are appointment-based.
Mary asked, do the health systems in Topeka have their own surveys? If not, should everyone enter information into the health department survey?
Yeah, great question. Derik?
Yeah, so we have a question on our survey that allows you to identify with a health system. We are encouraging those that do identify with those to reach out to them and, you know, ask them about identifying with one of the health partners. The surveys for the health department are specific to us, but again, allows you to identify a health system. And as that, both of those, all of our private partners work through their own processes. I believe that St. Francis has somewhat of a survey system that allows them to set up appointments for their patients. And Stormont Vale is kind of working, I don't believe they have a survey, more appointment-based and outreach. So it kind of depends on who you're affiliated with. And then again, just to circle back, the health department will focus on those who are uninsured or unaffiliated.
Great.
Jean asks, are the patients of Advent Health and Olathe Health getting preference over just the county signups?
Sanmi?
Yes, no, there's no preference here. And it's not just Olathe Health or Advent. KU Med has some vaccines also now through us. And St. Luke's is ready. So are Overland Park Regional and Menora. And we talk at our weekly meeting with our health systems on how to ensure equitable distribution across the systems. And also the health department is still running clinics. So I don't think the way to look at it is in terms of one group having a preference over another. It's just that we're all working through the list, and every vaccine that we give and the few that we're able to give every week is really chipping away from that large chunk of people in that group that we need to vaccinate. I think the way to view that is that we're all working together. We're working down the list. There are subtle differences in approach between the different entities, but the goal is to vaccinate as many people as we can, as soon as we can. If you have not received such invitation from your health system after you've completed the online form, we're just asking you to be slightly patient.
Mary is asking what our health system source of the vaccine is. She asks, is it Johnson County or is it Wyandotte County?
Yeah. So the short answer to that is our sources are variable from week to week, depending on who receives vaccine. Some weeks we receive vaccine. Some weeks the counties receive vaccine. Some weeks the federally qualified health centers in either county receive vaccines. And depending on expiration dates and number of clinics that can be run, there is sharing among all of those sources. So I would give you an answer today that will be different tomorrow. I think it's just important to recognize that this collaborative approach among entities, governmental and otherwise, continues, has been the case for many weeks, and we've shared vaccines doses that came to us with both counties, and both counties have shared doses that came to them with us. So that back and forth is very important. I think it underscores the collaborative approach and the importance of that we've all talked about, that this is about how we can band together to get the available doses in the arms of people who need it just absolutely as quickly as possible.
Couple more questions. Isaac asks, how is mask wearing in Johnson County? I listen to the commissioner meetings every Thursday, and it seems like a very contentious topic.
Sanmi, I'll toss that fun one right to you.
I will say that what has been impressive with our residents, been their cooperation, the understanding that vaccine is one piece of the puzzle. We knew that the holidays risk were going to be high, and we worked together again with our health systems. We had our CMOs online, just letting people know that it's not the time to give up. It's time to continue to wear masks. And even as we vaccinate, we are still sharing that similar message that we still have a long way to go. There's light at the end of a very, very long tunnel. It's a slow process. In Johnson County, I couldn't be more proud, more appreciative of the dedication of our residents to health, understanding that it's not about the individual, it's about our sense of responsibility to the community. People are wearing masks, people are physically distancing, even though it's been inconvenient and it's been a long one. Really appreciative of what our residents have done.
Last question today goes to Glenn, and I want to say we have fantastic questions, and I'm going to start putting them in for Friday already. Thank you to everyone in the community. Glenn's question is, do the counties publish how many vaccines they receive of each type anywhere for the public to review, perhaps on their COVID sites?
So, Derik, maybe start in Shawnee. Do you share that information about which manufacturer and first versus second dose publicly?
So if you go to kansasvaccine.gov, I believe still on the top right-hand side, it should be a data button that you can press. And if you scroll down, you'll actually see, to my knowledge, every county's distribution amount. And it really paints the picture of the different allotment amounts. And it's important to remember, all of our counties are different. We all have very different population bases. And this, I should mention too, the state's allocation, total allocation, is limited as well. And you can see the Find My Vaccine tool right there that kind of will list different allocation amounts. So,
yeah, it's a great point. I think most weeks recently, the Kansas allocation has been around 45,000 doses for the entire state. So hard to sort of fathom how that can go a long way towards the 2.2 or so million people in the state that we want to vaccinate. Sanmi, anything to add there?
Yes, in addition to the state website, if you go to our website, jocogov.org/coronavirus, you will see we do, and you go under, yes, if you go to the COVID-19 vaccine, we do publish how much we receive and how many we're giving out.
Thank you both. All right, well, tomorrow we really have a treat for you. Mitch Holthouse, the voice of the Kansas City Chiefs, will join us at the top of the hour to talk about staying safe in your bubbles for your Super Bowl parties. After that, the Chancellor of the University of Kansas, Dr. Douglas Gerard, and Chris Wilson, our Health System Vice President of System Integration and Innovation, will join to update you on reentry plans on the KU campus, and to answer questions about vaccines in that population. As we wrap up today, I'll hand it off first to Derik. Any final thoughts this morning?
thank you. Yeah, just appreciate you guys having us on. I know we were requested, so that's nice to know. And want to echo just the appreciation that we have as the health department to all of our residents here around the state, around the nation, for following the guidelines. We've seen our trends improve. And like Dr. Areola said, that light at the end of the long tunnel, it's getting brighter each day. And if we can keep doing those same mitigation strategies that we promote so often, I think we'll get there. Let's keep those trends headed in the right direction, and we'll get there together. Thank you.
Thanks, Derik. Sanmi?
Yeah, and again, to our residents, I absolutely love the interest. I love the emails and the questions about when will I get my vaccine. It's very important for us to get as many of our residents vaccinated as possible. That's what we want. And so we are happy with that. We can handle the feedback, the questions, and your concerns. We're just asking you to be a little bit patient with us. We are doing all that we can. We are not keeping any vaccines. We are using them as we receive them. We are looking for additional avenues to make sure you have options to receive the vaccines, and we are using them up as we receive them, not storing anything for next week. And so we just ask for you to be a little bit more patient. We will get to you. There's no need to call us if you've registered with us. There's no need to call HaysMed or any of the other health systems. They'll reach out to you. We're working through the process based on availability of vaccine. If we don't reach you this week or next week, we'll probably reach you the following week. So thank you for your patience.
Thanks, Sanmi.
Yeah.
Dr. Hawkinson.
Yeah, I mean, this is a process that's continued to evolve from the first shipments that were arrived for the healthcare workers. We have continued to evolve our process, as you talked about. We have a lot of pharmacists and nurses who have volunteered their time, who will continue to volunteer their time. When we get the supply, we are also ready and willing and want to help out the counties and as much as possible, make it as equitable as possible for all of the residents to get it. So we are ready when the supply comes. We are hoping if Johnson & Johnson does submit for an emergency use authorization, that will help our supply as well. In the meantime, right now it's just Pfizer, Moderna, but hopefully on the near horizon, it's going to be Johnson & Johnson, possibly AstraZeneca and Novavax, getting into that market and providing the supply, because we are ready. We have good systems in place. Those systems will continue to evolve, and we'll be able to vaccinate more and more people as the supply of vaccine arrives to us. So,
And I'll maybe end simply by saying there have been so many times through the last year or so now that I've been proud of our organization, proud of our ability to work with other partners across our community, even proud of the collective Kansas City community for our ability to respond and to prove that we can do what is necessary. And today I'm sort of feeling that way again for all of those reasons. I think, we talked about numbers being down, less hospital impact every day. All of the examples that you heard today about partnership between health departments in both counties and their healthcare delivery systems in their community, and the really great efforts that were mentioned by both Dr. Areola and by Derik around the efforts of the community to do what is necessary and to stay interested and to take the opportunity to receive their vaccine when it's offered. I think those are all really great things, sort of shining stars, again, that as we think back over what has not been an easy period of time, a number of months now, it's nice to have some of those positive things to highlight and talk about. So on that note, the combination of excitement over vaccine and a Super Bowl create a very magical time. And we want you to enjoy this moment, but also remember that there are many among us who are hurting because of the pandemic. Dr. Greg Nawalnik joins us with the final words today as he offers insight into this exciting time and the balance for those who might not feel like celebrating. Stay safe out there. We'll see you tomorrow.
It's that T-shirt that you wear for every game. It's that ratty, holy jersey that you've got. It's where everybody has to sit while watching the game. It's the one thing that if it's not that way, it's the first thing that comes to mind when things go south in the game. Ultimately, it comes from our human desire to have control over things. And with something as emotional as a football game, there's swing and momentum and a lot of things that are beyond our control. Teams across the NFL were impacted this season by COVID. Some teams lost up to a month of practice time. The Chiefs managed to stay the course, do what needed to be done, stay safe, and bring their full squad into every game. And so I think that this is a model for our community. We need to stay mindful of the dedication that got them there and not divorce ourselves from our own responsibility. When we talk about, the Super Bowl, a lot of people get excited and think about big parties. Well, this year, we just can't do that. And I think that it's about still keeping the distance, wear the masks, get the vaccine if you can, Those are the big plays that we can make so that we can avoid a Super Bowl spike and keep the only spikes that we see on Super Bowl Sunday or afterwards to be the replays of Travis Kelce touchdowns. Think back to the beginning of 2019. Could you believe that the Chiefs would win that Super Bowl and then bam, right after we get slammed with a global pandemic? The outcome of the Super Bowl is not going to take us out of all this. So it's great. Let's cheer them on. Let's get excited. But, let's remain mindful that a lot of people are really hurting. And this is just a distraction. It's not everything.